Today we welcome Dr. Melita Moore, who is an entrepreneur and operates a company that deals in esports, levels unlocked. What?
Levels Unlocked Enterprises.
Levels Unlocked. I should know that term by now because
That's
of
okay.
all the conversations I've had with game players. And she has a very interesting perspective for us about the physical challenges of being a video game player to the extent where they're being called esports people and the amount of time they spend in front of a screen. I would be remiss if I didn't say she was the team physician for a number of men's and women's professional sports, including the Sacramento Kings at one point. So let's just start out if we can. If you wouldn't mind, excuse me, telling our audience where you went to medical school and give us a little bit of your navigational history.
Absolutely. Well, first of all, thank you very much for having me. I'm very excited to speak with you and your audience. You know, I'm a physiatrist. I'm a physical medicine rehabilitation physician. So therapists are my world. I could not do my job without this multidisciplinary team. So I'm just really excited to be on and spend some time with you. I'm from Columbus, Ohio, so I'm a Midwest girl, and I went to undergrad at Hampton University, which is a historically Black college in Hampton, Virginia. And then I went to the Ohio State University for medical school, and then went on to do my physical medicine and rehabilitation residency in Baltimore at Sinai Hospital. And then I found myself at University of California, Davis, at UC Davis for my sports medicine fellowship. And I went for a year, and 7 years later, I was still there. And so that's pretty much kind of where my career has gone. And in the past 3.5 years, I moved to the DC area, which is where I had the pleasure and the honor of taking care of our WNBA world champion Washington Mystics in 2019. We won the championship, our NBA G League team, and our NBA 2K team, which is a professional video gaming team, or esports team, which is how esports fell into my lap. And then more recently, just within the past few months, I've resigned from that role and have really focused my time as the CEO and founder of Levels Unlocked Enterprises, which is a brand marketing and communications firm. We're really focused on sports, esports, and health. So we kind of have that nexus there. And then I also have a new concierge practice called Level Up Sports Medicine, which is really based about wellness. So it's lifestyle medicine, culinary medicine, and really focusing on post-COVID recovery.
Well, you've introduced a number of topics there, including the COVID pandemic. And if I recall, some of the way you kind of gravitated over into esports was because some of your clients, or I guess patients, I would call them, were professional athletes. And I gather from what I've been viewing is that the time spent on the road as professional athletes during the pandemic has kind of locked folks in a room, and they're spending time playing video games. Can you kind of expound on how you got into the video game world?
Yes, and I tell everyone, I didn't find esports. Esports found me. I was voluntold by my hospital to be their team doctor of our professional team. I was on a call, and I got off the call, and I said, "Why was I on this call?" It was like, "Oh, you're going to be their team doctor." And this was in 2019, so I didn't really know anything about esports. And esports is just professional video gaming, and so they are traditional professional athletes. They're called esports athletes. Or professional video gamers, but usually esports athletes is kind of that terminology. And so I asked, why did you all choose me to be their team doctor? And, I'm quadruple board certified. So not only am I PM&R, that's my training, sports medicine, I'm also brain injury medicine certified and lifestyle medicine certified. So when we're talking about gamers, I'm one of the few team physicians of a professional esports team in the United States. And that was really just because they asked me to be the team doctor, I could have just said, hey, let me just do your quick physical and be done. But I really wanted to dive a little bit more into what a professional gamer could need. And what I found was exactly what our traditional athletes need. And yes, you are correct. Our professional athletes, they game a lot. That is usually what they do in their downtime to kind of help with stress, or like after a game to try and help kind of come down. And so it just kind of all fits perfectly together, seeing that merge of traditional sports, esports, and how it all comes together.
And I would have expected, as I started looking into your history, that you were going to tell me that it was the wrist and carpal tunnel. But the first thing that I'm seeing or hearing is you're concerned about the player's vision.
Yes,
So
absolutely.
Speak to that if you would, please.
It's really interesting, Rob, when I went to do some research about what a gamer could need. There's not a lot of information out there from a research perspective on health and wellness for gamers. And so I really just had to put together a robust team of what I thought a gamer would need. And mental health is really number one. And so sports psychology, we have a sports psychologist that works with our team, that meets with them every week. And that's mental health on the goods, the negative and the positive side. Gaming can be very isolating. Depression, anxiety, sometimes it kind of rubs its head there, but also on the flip side, more of the team building, on how to get into the zone, how to play as a team. So sports psychology, mental health is really number one, and vision's number two. And nobody was really talking about vision. And when you think about a professional gamer, Rob, they train around 14 to 18 hours a day. So they're on a computer screen, seating, playing a video game in front of a monitor. And professional gamers, they can make anywhere from 400 to 600 movements a minute with their hand. Can you imagine how fast and how much motion has to go on for that hand-eye coordination? So when we talk about health and wellness for gaming, it's mental health, vision health, lack of exercise, so the sedentary lifestyle, certainly nutrition. And we talk about ergonomics when it comes to that, and then musculoskeletal injuries. So when I chose to put our medical team together, we had more people on our medical team than our 6 athletes. But, we had a sports medicine doctor, we had an orthopedic hand surgeon, we had a hand therapist, a vision therapist, a physical therapist, an optometrist, our sports and performance, an ergonomics specialist, and a nutritionist. And so when we talk about, hopefully our audience that's watching today, when we're talking about therapy and different kind of roles that therapists play, if you haven't heard about esports, if you haven't heard about gaming, this is just really something to look into, because this is certainly where we're moving. Gen Zers, millennials, they all are gaming. There's around 135 million gamers in the US. They have injuries. They have terrible posture. They have, yes, a lot of upper extremity symptoms. And so for therapy, this is just really where I think we are moving and shifting to, where we're going to see a lot more people. And it just goes over to working from home too. Everyone's working from home now. So all those things that are coming into the office, this digital lifestyle we're living in. So there's a lot of crossover there.
Well, Dr. Moore, I can't skip by this mental health piece. As I began to study this group and look and see were there needs here that we could help with, I found it fascinating, some commentary that some researchers were concluding that our esports players actually had a better pandemic experience because they built a social network and were talking and watching and really engaging at a time when a lot of other people were isolated and became depressed. Is that line up with what your findings were as well?
Absolutely. And so when we talk about the mental health perspective from gaming, and we look at it even at the younger age in elementary, middle school, we know that it's a way that they can be socially connected. So what the research is showing is that younger age gamers, they have more social connectivity because they're used to talking to people on the headset. So when they do meet people in person, it's not that awkward interaction. So they're more social, they're more engaged, they're more creative. And so, yeah, for the pandemic, for gamers, being able to work from home, maybe jump on a game in between a call, it was really, I believe that they had more of an easier transition during this time because this digital world is where they live.
Yeah. I've done a couple of interviews now with college age players. One was on a nationally competitive team from Boise State. And another one is a young man here in Spokane, Washington, who aspires to be a professional gamer and spends the amount of time that you alluded to, trying to get people to subscribe and follow his gameplay online. Yeah. Kind of mind blowing for a guy like me, but I guess, it's their reality. But now, every time I start to talk to them about how often do you get up, stand up, go to the bathroom, get something to eat, it seems so captivating that they're suppressing some of these natural phenomenon. And even as it goes, and maybe you'll explain your 20-20-20 on vision, if you would please, the prospect of getting someone to spend time away from the game every 20 minutes seems challenging. Have you found any secrets there? So explain your 20-20-20 mantra there.
No secrets. So when we talk about the 20-20-20 rule, our vision therapists out there, they're shaking their head. I'm sure they know exactly what this is. So we are teaching this, that every 20 minutes, you look 20 feet away for 20 seconds. And what that does, that resets the muscles in your eye. So it just gives your muscles a chance to kind of reset, refocus. And so it's a very short break. All of us need to be doing that. I tell people to measure out 20 steps, 20 feet, post something on the wall or on the floor, just something that's away. So it's always there, and set a timer on your computer or on your phone. And that every 20 minutes you look away. Now, during a game and during competition, that's not happening. But if they can pick that up, at least during practice, when they are taking this time to practice, but that just really helps to reset the eye when we're looking at the screen. There's something called computer vision syndrome or digital eye strain, where you get that super dry eye. You're blinking a lot more because your eyes are not producing as much tears or as much fluid. You start to get that headache that goes on, or that ache and heaviness behind your eyes. You absolutely need to be looking away. I mean, that's not even including like blue light, but that's just really trying to talk about the muscles of your eyes.
Have you found any tricks to get them to incorporate this? The conversations I've had with other therapists have suggested that unless we could find a way to either gamify or digitally measure and show that there was an increase possibility or increase in performance level, that the uptake on these different habits that would help people. You got any clues for other therapists?
I don't, but it all comes down to performance. All of this health and wellness comes down to how are you going to perform better. And so that's, like I said, the research is now starting to pick up a little bit, but when you look at other sports like football, there's over 7,000, peer-reviewed publications on football, or soccer, there's over 4,000. For esports, there's 66, which is such a small number. But, University of California, Irvine, UCI, New York Institute of Technology, they are really pumping out a lot of fantastic research when it comes to esports and gaming. And so there's a study that's getting ready to be published just about simply taking a walk every excuse me, taking a 6-minute walk will actually help to improve your gaming performance. Right. 6 minutes. You can step away for 6 minutes. You don't even have to go outside. It would be great if you did, but even getting up and walking around for 6 minutes is showing that it's improved your performance. So for gamers, if it's not going to help them game better, they don't want to do it. So you are right. We do have to find a way to kind of have this data that shows that you don't need to be practicing for 14 to 18 hours a day. Shorter practice time actually helps to improve your performance. It's tricky, but there's a lot of research to be done. So if there's anyone that is interested, certainly this is an area that is growing, that there's not a lot of information there, but it's definitely needed.
I think that's Dr. Donahue's work at the New York
Mhm. Yes, it is. Yeah, she's fantastic.
And she's pretty plain spoken about it too. But let's just dive a little deeper there because of your experience with professional athletes. You know, there's the folks that come with talent. There's the folks that come with that grinded out mentality that just get incrementally better. And then the best ones are the ones that have talent but keep working on their game.
Yeah.
And we've all seen all the recordings of practice, you know. That sort of
I hear
stuff.
you, Allen Iverson.
Yeah. But how, as a team physician, any little tricks or tips you picked up working with the more physical? I don't mean to diminish the physicality here, but the more physical sports.
Yeah, so it's so important for warm up, cool down, pre-game, post-game, your stretching, your routine, getting into a set habits. When we look at our traditional professional athletes, there's no way they're stepping on the field or stepping on the court without doing their pre-game warm-up, which is a series of stretches, maybe some small bursts of, some like hit things. But for gaming, because there's no pipeline for gaming on it going from like a path to pro, like there is in traditional sports. And in traditional sports, you learn from a very young age how to take care of your body, why you need to be hydrated, why you need to be doing these things. And so I think that is something big that we are able to take from the traditional side and start to bring into that esports side. And, when we are talking about a warm up, it's a lot of hand, a lot of wrist, neck, upper extremity that we're trying to come up with these programs that teams can incorporate, individual gamers can incorporate to say, let's just do let's warm up first. And then, you get into gaming and there's a cool down period. There's recovery. Recovery doesn't exist in esports. They don't really understand this mode of recovery and why you need to recover. And maybe you are in, you're doing a little ice bath maybe after for your hands and your wrists. I mean, all these things that you're doing, it just really, because there hasn't been this traditional buildup, it's just all kind of happening now.
Yeah. And so you're a team physician for an esports team. What do you do there in warm up, and what do you do for them?
So it's really, so I resigned again from that job about 3 months ago along with my other professional teams. But as the team physician, thankfully there was not much for me to do outside of education and awareness. So for our team, our NBA 2K team, they compete over a weekend. So they compete around 3 to 4 days in a row. And their matches, there's usually 3, best out of 5. So their matches can go pretty quick, but they're doing it for 3 to 4 days. So there's nothing really for me to do in the moment like it is for our traditional athletes. Someone goes down with a knee injury, an ankle injury, I'm running on the court or running on the field. That doesn't happen for esports. It really happens before competition and after competition, and really with education and awareness. And you should be doing these things. And we have our hand therapists come in and take them through a program. Our sports psychology, we talk about doing a brain dump after. So it's just more around education and awareness, nothing kind of in the moment as they're actually gaming.
Do you have, let's go to the hand for a second, because it's the, as you've talked about, all the sort of micro movements in rapid fire there. Are you advocating both flexion and extension exercises pre and post?
Yes.
More extension because it seems like they're flexing all the time, or do you advocate for some, I know with the shoulder post-op, there are flexion exercises that are being done, even though there's a lot of extension that has to happen to break up scar tissue. What's your perspective there?
So it's different on the game that they're playing. If they're playing on a PC, which means they're using their computer and a mouse. If they're playing on a controller, depending on the game, you may hold your controller a different way so that you can hit the different buttons on the controller. So it depends on their game. Even with the PC-based game, there's something called WASD, which is really the keyboard, WASD, it's called a key grip. that
Yeah.
most games will use, but other games use different motions. And so some you have to do a lot of lateral motion and hit that caps lock. And so you're getting a lot of extensor carpial ECU, tendonitis through here. You're getting some TFCC stuff. So a lot of lateral wrist motion. But if you're playing a game that you're using your thumb more, you know, you're doing more radial motion or more extension. So it really just all depends on their keybind, the game that they're playing, and what the grip and things are for that. And then that helps to kind of make their program specialized for them and their game and their gameplay.
Fascinating.
Who would think about all this stuff?
Right. And the things a therapist needs to think about when we're not going to be just talking about the traditional forms of exercise, you're going to have to look at how they're spending this 10 to 12 hours a day.
Correct.
And then develop a program really tailored to that.
I think so. I mean, that's just like, you know, not every ACL post-op is the same kind of recovery, or you have a general program, but, you know, you do some fine, you make some adjustments. But I think with gaming, especially with upper extremity, now when we're talking about neck, low back, hamstring, of course, those hamstrings get super tight because they're seated for so long. That's general. But when we're talking about really upper extremity, that's when it should be more tailored. And even for the therapists who don't know anything about gaming or about esports, there's all kind of videos that you can watch. So you can go onto Twitch and you can watch a person playing this game that, you know, your patient may play. I'm sure they probably have their own footage that's up, or you can go on YouTube and you can see how they move their hand and what their hand is doing on the controller. So you can have a better understanding of what your treatment plan is going to be. You know, usually from a physician, when not me, because I truly believe in writing a very specific exercise prescription to our therapists, but then of course, giving them the flexibility to do whatever they feel like it's the most appropriate. But when you get that evaluate and treat referral that's coming your way, that's when you really get to make this your own, and you really talk with your patient, see what they're playing, ask them to show you, bring in their controller, bring in their keyboard or their mouse, and really give them a really tailored program. It will make the biggest difference. But what we do know is that gamers don't go to the doctor. We know that they will have pain, they will have numbness and tingling, they will have loss of strength, migraines, and 2% of gamers actually will go to the doctor if they have an issue. So, you know, in some of the states, 2%. So in some of the states where you don't have to have a referral to therapy, I think that those states will probably see more gamers, because they'll say, oh, let me just go to a therapist to kind of help me feel better, and not really think about, you know, I need to go to a sports medicine doctor or to a physician. So right. I just really think this area is just growing exponentially, and there's just so many things that therapists can do independently to show, you know, hey, we treat gamers too, and putting out a gaming program. I think this is a great way for marketing and to get more patients in the door.
I think you alluded, or I read somewhere, that there are now forming some healthcare advocacy associations around esports. Are you part of groups that are trying to have this conversation?
I'm not part of those groups. I am a board member, the chair of the Health and Wellness Commission for the Global Esports Federation. And what we're doing at an international level is really talking about the importance of health and wellness. And so we have almost 100 countries that are under our federation that all have esports federations. And so what our goal is that we're giving information from the top and having it trickle down so that everyone has access to the education and the awareness. We're partnering with UNESCO on, a fit for life, an active, healthy digital lifestyle program. We have something called Performance Plus, which is about engaging gamers and people for health and wellness and creating these healthy digital lifestyles. So I'm not part of these advocacy groups, but I am doing some work on a global level that hopefully will give people the knowledge that they need.
So it sounds as if and a therapist who might want to head down this pathway and do some specialty work here could do a reasonable Google search and find themselves folks that are clustering up in these areas now.
They could do that, or, Rob, by the time this interview comes out, news would have dropped that there is an esports medicine handbook that is written specifically for healthcare providers. Dr. Lindsay Migliore, who's known as the Gamer Doc, she has been very instrumental in this space in esports and esports medicine. Dr. Kate McGee, who is a doctor of physical therapy, they were more the authors of the book, and I was the editor of the book. And so this is available on Amazon. I have a copy right here. But this is called the Handbook of Esports Medicine. It's the first ever book geared towards healthcare providers about gaming and about esports. And so this is an excellent tool for therapists, for physicians and other healthcare providers who may be treating gamers or want to get into it, and they will have the knowledge here. So it is self-promotion, but it's really, really more to say. There is now finally a textbook that's there that's going to help us teach other people.
You named two other physicians there, both of them female. And do you want to take a moment and comment on about the fact that here's a platform where everybody starts out on the same competitive, there's no gender bias when you're on a screen with a computer. Well, pardon me, I can't really say there is none. Here's what I should be saying. I can't tell who I'm playing, right? If I were a gamer.
You can. This is a big problem in gaming. So women in gaming, it's a huge, huge culture that women in gaming really are disenfranchised in gaming. You would think, how is this gender based? Because you're just playing on a video game. I thought the same thing, but there is so much inequity within the gaming field. There's a lack of diversity. And so when you get on the headset and you hear my voice and we hear your voice, a lot of times the cyberbullying is very, very, it's horrible in the gaming industry. And, so they'll say, there's a lot of derogatory comments that may come from that, but also competitively, let's say a game like NBA 2K, which is the basketball version of right. Gaming, you have like the point guard is the one that really is driving the show. Well, if I'm the female point guard and you're the forward, you never pass me the ball. So then I can't get enough points. And so now I can't be available to get into the draft. So now I can't become a professional player. So there is a lot of gender bias in esports that people would never think of. There's so women in gaming is really big. We really try to promote as much as we can to support women in gaming.
So just the over the headset chatter,
yeah,
it can be enough to open a door to a bias. I can see it now that you bring it to my attention.
Yeah, so there's a lot of companies that are working with like AI and, to make your voice like maybe a robot or, so you never have to really come on screen. If you're not comfortable coming on screen when you're streaming and when you're playing, no one has to see who you are, but they can hear your voice. So girls, sometimes young girls or women, they will try to disguise their voice and make it deeper. It's just so much that goes on. In video games, women aren't represented. So this is why representation matters in so much of what we're doing in the gaming space. If there's not the people that are creating those stories, those game stories, we'll never see ourselves in the game. So yeah, I'm a huge advocate for women in gaming.
Well, forgive me for jumping to that.
We just don't know. Yeah, we just don't know.
Well, I was hoping we'd found a place where the pay was equitable. The prize money was equitable. We're not there.
The prize money is equitable, but there aren't many female professional teams. So there aren't that many female professional esports athletes. So the few that are there, they are getting paid the same, but this is still probably 98% male.
Yeah. Well, but I think the article on you in Forbes said that about 40% of all game players are
women.
Female.
Absolutely. So we are in the industry. We're playing, but we're not on the professional level. We're not getting the opportunity or the visibility to play on the professional level. So they're now creating women's leagues, and that's a big controversy if it's good or bad for the industry, but at least women have a safe space to be able to go and showcase their talent and their skill.
Good. Well, Dr. Melita Moore, I think we could go on for an hour here if we wanted to, but fascinating topics. Is there a place people might go to follow you? Are you doing any social media that you'd like to tell us about right now?
Sure. I'm on Twitter and Instagram at Level Up Doctor. That's my moniker. So Level Up Doctor. And then, of course, my LinkedIn under Melita N Moore. And you can go to our website, levelsunlock.com.
Okay. Well, thank you so much for joining us. Appreciate your time today.
Well, thank you so much. Bye, guys.
Bye-bye.